Hi everyone, it's Julie. I just want to say hi and give an update from my walk from the other morning. I meant to get on later on to let everyone know I did complete my 2 miles. It wasn't the most pleasant. My last 5 minutes, it took me about 45 minutes to complete it. I used to walk 5 miles every day like it was nothing. I'm a registered nurse. I do 12-hour night shifts. I do lots of activities. I snowmobile. I do jet skiing. I'm always busy doing stuff around the house, putting floors in. I like to do my own stuff. I am not really very easy on my body, and as you get older, things don't quite work as it used to. And being a nurse, I know that everyone's different with how people heal, and of course I was one of them that didn't quite go as planned. I had part of my meniscus removed back on April 30th, and they cleaned up some of the arthritis. I've had this for quite a long time, but I didn't really know anything was wrong until January when I actually fell on my knee. And I, of course, kept snowmobiling and doing what I do. I work 12-hour night shifts all the time, and I do lots of housework, painting, putting floors in. I don't really listen, so I ended up with severe knee pain, and just one day it snapped. So trying to get back to the swing of things is not going the way I wanted to go, and so I'll take the 2 miles the other day. I wanted to do my 5, and it's a work in progress. I ended up doing my 12-hour night shift later on that night. Didn't really have too much problem. Everyone said how I look great compared to last week. I was moving very well. Last night was a whole nother story. It was very painful. Of course, I stood on my feet almost the whole 12 hours nonstop. Couldn't really sit when I wanted to sit. And that's what happens when you're a nurse. You don't always get to sit. There's always things to go do. It doesn't matter if it's days or nights. It just happens. So it just wasn't a good night. And someone pointed out my shoes. I love wearing Danskos. I've worn them most of my nursing career. Back last year, I started wearing my sneakers, Nike sneakers, any sneakers, just the comfort sneakers. Never had too many problems with those, but I've been wearing my Danskos, and someone pointed out they're not really good when you have surgery, whether it's something for your back or your knees or any other joint. And I realized that maybe there's something to that. I never thought anything of it. So next week, I'm going to try not to wear them and see if that helps. It seems like whenever I walk or do, most of my activities when I'm at home, I'm always in sneakers. I'm not obviously wearing these Dansko shoes. I love them. They're great, but they are kind of hard on my feet. And I started realizing maybe they're not the best for post-surgical patients. So that's one thing I will change. I did not do any exercises today. I actually wanted to go back to work again tonight. And since I'm a per diem nurse, I get to work when I want to work. I decided to keep it at the 24 hours this week, and just paycheck won't be that great, but my body needs to heal, and I need to take some time off to reevaluate some things I'm doing and not make it worse. So next week I'll go back and see, put in maybe just 24 hours again and see if I can add another day. It is what it is. So anyways, I just want to at least say hi and keep that up to speed. I know some people might think this is boring, and sorry if you don't like me. I'm not out here to impress anybody. I'm just trying to give some perspective that, even at my age, shit happens. So, and I think I mentioned other videos. 3 years ago, I had a heart attack on STEMI. Of course, with me, it's always the bad things. I don't have anything small, colds, little things. That's not what I always had growing up. For the most part, it's always been the bigger things. I've had viral meningitis, periorbital cellulitis, you name it. Let's see, I shattered my heel 3.5 years ago. That's kind of what led up to my heart attack. Had blood clots, and I'm 46, so I'm not immune to everything. And that's my whole point to some of these videos, that nobody's perfect and that we're all different, and it doesn't matter how old you are, things are going to happen, and it's just the way it is. And trying to take things into perspective and to re-navigate how I live my life. Of course, too, with this whole thing, I've gained a lot of weight too, which that's a whole nother thing. It doesn't matter what body type you have. It's everyone's made differently and heals differently. And of course, because I ended up gaining 25 pounds during this whole process, that's also putting a lot more weight on my knee, which is very discouraging to me, because I always, when I was younger, really valued being fit and trying to keep my weight down to a certain number. And I realized it's not about the number, it's about how I feel. And I don't feel very good right now. I definitely feel it. I feel it in my joints. I don't like it. It's just very uncomfortable, but I can't do anything about it. So even with the heart attack years ago, I realized I have to just be healthy. It's about being healthy all around, mentally, physically, emotionally. Just how do I feel? I want to feel good. I don't want to feel drained. I want to feel like I'm awake and not too tired. Skin tone, hair, everything. It's the whole everything. So, yeah, not to bore anyone, just thought I would just give some tidbits and just to say that, you're not alone out there, that we're all different and shit happens. So, anyways, that's enough for now. And I hope people still enjoy these videos. And again, sorry to those that don't like them. I don't care. You can just don't watch them.